Nowadays, I see many cases and I get many calls from patients saying that they are suffering from migraine. They think one-side headache is migraine. And remember, all headaches are not migraine and all migraines are not migraine. Hello, I am Dr. Pavan Kumar Bichal, a pain specialist attached to Apollo Hospital, Jubilee Hills, Hyderabad. So we'll talk about one-sided headaches and in general headaches today. Patients come to me with one-sided headache saying that they are already diagnosed with migraine. Most of the times it is not migraine. There are other conditions which mimic migraine. When I examine my patients, 8 to 9 of the migraine diagnosed patients are not migraine. Most common headache is tension type headache. There is no cause. This is called a primary headache. The second most common cause is diagnosed cause is migraine, but there are other causes which are more common than migraine. Literature says migraine is second most common, but in our experience, occipital neuralgias or cervicogenic headaches cause headaches. One-sided headache or bilateral headache. Migraine shifts from one side to another side, and same way cervicogenic headaches also shift from one side to another side. Why it is important to diagnose the cause of the headache? Because the treatment is different for each condition. For example, if a patient is diagnosed as migraine but it is not migraine, the treatment differs. The tablets differ, the lifestyle modifications differ, and there are some interventions which treat migraine, which treat other conditions like, for example, autonomic cephalalgias or cluster headache. They all cause unilateral headache or sometimes bilateral headache. What we do as pain specialists, first we diagnose the condition by proper history and then clinical examination of the patient. Then once we come to a diagnosis, that is provisional diagnosis, if necessary, to rule out secondary headaches, like for example, some tumors, brain tumors or some other conditions in the brain can cause headache. We have to rule out those conditions before calling them primary headaches. So once we rule out those conditions, we treat by prescribing some medication, asking the patient to do some lifestyle modifications, stress release, then prescribing some medications which are easy over-the-counter available medications like paracetamol. They can be taken twice or thrice a week. If you take the medication more than that, it can cause rebound headache, that is withdrawal headache. So if patient requires more than 3 times in a week a medication, we ask the patient to come for an intervention, small, very easy interventions which can be performed in an outpatient unit, and patient gets complete relief of the headache. Thank you.